Posture actually is one of the ways that exacerbates back pain or promotes back pain and muscle strain. My name is Clifford Voigt. I'm a medical physician, specifically in orthopedic surgery, sports medicine, and shoulder and elbow surgery. I work at One Brooklyn Health. So back pain is actually very common. Second to back pain would be actually respiratory illnesses that are seen every day in hospitals or doctors' offices. About 50 to 80% of the population has back pain in their lifetime. Common causes of back pain range from muscle strain, disc bulges or ruptures, infection that presses on the nerves, tumors. There's a lot of different causes, and most of the time it's actually coming from muscle strain. That's a good question. So I think the way to think about back pain and the issues that are associated with them and when to actually contact your physician or possibly go to the emergency room is these red flags that I've come up with. 4 of them are the ones that I would keep in mind. One is symptoms of infection. So you'd have back pain, but you'd also have a fever or chills, right? Or you think about somebody having cancer or some type of tumor related to the spine, they'd have weight loss, so unexplained weight loss, not something that they weren't expecting, they were not doing, going to the gym or eating less. Another cause that I think of is trauma. So whether you're in a motor vehicle accident and after the accident you start to feel pain that's excruciating and doesn't get relieved with rest. And then one of the last ones that I keep in mind is back pain where you also have bowel or bladder changes, meaning you have difficulty going to the bathroom or urinating, or difficulty with your bowels. You want to be able to look at how you're carrying heavy objects. You'd want to limit the amount of heavy objects that you're carrying. And if you do have to lift something heavy, you want to lift from your knees and bend at your knees and not from your hips. And you want to keep the object close to you versus further away from you, as that perpetuates more muscle strain. You'd also want to make sure that you keep the weight off your body. You want to maintain a healthy body weight, that there are certain ranges for your height and weight. And you will also want to make sure that you're strengthening your core muscles, so abdominal muscles and paraspinal muscles, as well as stretching on a regular basis. I think it's actually important to rest when you have back pain, but not too long. So I would actually suggest the patients spend 1 to 2 days of rest, but then you want to actually do some light walking and maintain some structure in your back. One of the things I did forget to mention is the posture. Posture is very important. So that's why I mentioned working with your core and strengthening your core, because posture actually is one of the ways that exacerbates back pain or promotes back pain and muscle strain.